The VetOvation team provides laparoscopic and endoscopic equipment along with training to veterinarians interested in adopting this technology. The system is affordable and easy to adopt for many routine procedures. The VetOvation Smart Scope utilizes your iPhone to examine a client's ears or nose. This affordable, easy-to-use system enables you to take pictures and video that can then be shared with the pet owner. The Aesculap Cayman is an easy-to-use vessel sealer that provides secure hemostasis for vessels up to 7 millimeters in diameter during open and laparoscopic procedures. Using the Cayman decreases anesthesia time, blood loss, and tissue trauma during many common procedures. VetOvation provides two primary product platforms, the Smart Scope and the VetOvation Surgical System. We believe minimally invasive surgery is not just about smaller incisions. Applied correctly, it is safer, less painful surgery that results in the patient returning to normal activity quicker. This technology extends your ability to see into areas of the body your eyes can't go. The instruments are smaller than the diameter of a straw and can do anything your human hands can do. Many general practice veterinarians are finding the following list of procedures easy to adopt and well accepted by their clients. Patient positioning is a critical part of laparoscopic surgery. The Tyson tilt table enables you to quickly rotate the patient from side to side or in a head up or head down position so that gravity moves the organs and bowel that you don't want to operate on out of your way during the procedure. During the adoption of laparoscopic procedures, VetOvation promotes keeping you in your comfort zone. We suggest making your initial incision in the midline, then dissecting down to the linea alba, placing a cranial and caudal stitch into the linea, then pulling up on the sutures to retract the abdominal wall away from the internal viscera. Once the trocar is placed, low-flow CO2 is introduced into the abdomen to create a working space. During a laparoscopic spay procedure, 2 or 3 trocars are utilized to visualize, grasp, and retract. The Cayman vessel sealer quickly coagulates, then transects the tissue safely and effortlessly. Once the ovary is transected, it is removed through one of the trocars. A laparoscopic gastropexy procedure can be easily accomplished with the aid of the laparoscope. An atraumatic grasper is utilized to retract the stomach to the abdominal wall. A 4 to 5 centimeter incision is made at the location of the gastropexy site. Tacking sutures are placed into the stomach. A seromuscular incision is made into the stomach, and a running stitch is utilized to attach the stomach to the abdominal wall. At the end of the procedure, the scope is reintroduced into the abdomen so that images can be captured and then later shared with the client. Laparoscopic liver biopsy is another extremely beneficial application for this technology. Utilizing two 5mm trocar ports, all 6 lobes of the liver along with the gallbladder can be inspected. Abnormal liver tissue can be biopsied and then sent to pathology. Laparoscopic assisted cystoscopy is also a common procedure for many general practice veterinarians. A small incision is made at the apex of the bladder. Stitches are placed first in the linea alba, then a tacking stitch is used to retract the bladder. The scope and a stone spoon can then be used to retrieve stones from the bladder. During the procedure, you can visualize the ureteral orifices, take tissue samples, and at the end of the procedure, the scope is placed down the urethra to make certain no stones are present in the urethra. The Cayman vessel sealer is not just for laparoscopic procedures. Splenectomy cases will be performed quicker with significantly less blood loss and shorter anesthesia times. Vessels up to 7mm in diameter can be quickly coagulated, then transected, thus eliminating the need for sutures. Soft palate surgery is another procedure that can be performed at the time of a spay or neuter in the matter of a few seconds with the Cayman vessel sealer. The VetOvation Smart Scope is an affordable scope for video otology and rhinoscopy. The VetOvation Smart Scope utilizes a standard scope with a 9-watt LED light and an iPhone. The anatomy is seen through a specially designed app that enables saving pictures and video that can later be shared with a client via email. This is an excellent way to view anatomy and diagnose recurrent or underlying problems inside an ear or nose. These images can also be viewed by the client during the exam or shared via email. The Smart Scope is a specially designed video otoscope that helps treat animals with recurrent ear infections. The system allows for quick and easy inspection of the middle ear and the tympanic membrane. Removal of excessive hair and wax enables medication to better reach the infected areas. During an exam, irrigation and a flexible grasper can be used to loosen wax and remove debris. The Smart Scope is also a valuable tool for rhinoscopy. The system can be used to evaluate and biopsy the turbinates and nasopharynx.
I find that the Smart Scope is a little bit easier to use than a standard otoscope. For one thing, the image on the screen is much more visible and I can identify structures a lot easier. Also, when using the Smart Scope, I'm able to stand a little bit further away from the patient. So for that dog or cat that doesn't necessarily want their ears looked at, I feel just a little bit safer using the Smart Scope than a standard otoscope. So as a diagnostic tool, the Smart Scope I use very similarly to a standard otoscope, but I'm able to get more information and use that information to share with clients or with fellow veterinarians by way of capturing those images and using them later.
The Smart Scope system comes with a 0-degree scope that is 6 millimeters in diameter and 90 millimeters long. The dual channel sheath accepts a flexible biopsy or serrated grasper, enables continuous or intermittent irrigation through an IV bag or with a red rubber catheter that's hooked up to a 60 cc syringe. The 9-watt LED light attaches directly to the scope and comes with a lithium battery and recharging station. The system is compatible with an iPhone 4S, 5, 5S, 6, and 6 Plus. For additional information, please contact VetOvation or visit our website at www.vetovation.com. You can also call us directly if you have additional questions at area code 919-247-0328. Thank you.